Hello and welcome. My name is Joel Vedder, Coordinator of the Medical Reserve Corps. Today I will take about 30 minutes of your time to review with you through this webinar the Medical Reserve Corps orientation on behalf of the County Executive and the Commissioners of the Department of Health and the Commissioner of Fire Rescue. Welcome and thank you for taking the time today to participate. Over the next 25 or 30 minutes, I will discuss the various objectives and critical concepts of what will be expected of you and your choices of involvement and expectations within the MRC. I will ask you to consider any questions and write them down. At the end, I will provide you with my my email address in which you'll be able to send those questions or points of clarifications across to us afterwards, and we'll be able to answer those for you in that manner. Frequent FAQs will be posted to the website of the Medical Reserve Corps, which we'll provide for you shortly as time goes on. Medical Reserve Corps came into effect in 2002, post 9/11, under President Bush. And there was a mixture of programs created under the Freedom Corps. In 2004 is when the local Suffolk Medical Reserve Corps started. At that point had a small, just under 100 components under the Citizens Corps Council. Some of the other partners that we work with here in out of the Office of Emergency Management and Citizen Corps Council is our Community Emergency Response Team, the CERT team, non-clinical civilian volunteers assist us and work usually hand in hand with the Medical Reserve Corps as flow controllers, IT personnel, and support things. Right now, presently, where we stand in our Suffolk Medical Reserve Corps is at just under 500. We have 126 physicians, 33 physician assistants, 25 nurse practitioners, 144 nurses, 10 pharmacists, 31 dentists, 3 veterinarians, 14 mental health professionals, 37 EMS professionals, 5 respiratory therapists, 35 allied health professionals, and 28 non-health professionals. The 28 non-professionals, usually what we end up taking is people that provide unique assistance to the Medical Reserve Corps, IT backgrounds, things along those lines. Traditional, regular civilians within Suffolk County that are looking to volunteer would mainly be streamed towards the CERT team, working with us hand in hand that way. So that gives us 491 as of March of 12, and we have 207 additionals that are pending completion of their serve process, and then this orientation, and we carry on from there. Our main mission, right, is to tap into that expertise that you supply into the existing public health structure. In 2004, when it was started, it was with the intent of assisting during major emergencies or disasters. We're now looking over the last year and a half to expand that into more of a true public health education and prevention aspects, and we will discuss some of those various programs that we could kind of get involved in and see the difference that we're able to make in the county directly. Generally, the MRC will only be called upon to assist with emergencies or events that are within our jurisdiction or our county. Volunteers may opt to assist in other areas, but will be responsible for their own components during those operational periods, non-emergency components. But what is key is to understand that unless we are activated, and all activations are required to come through myself as the regional coordinator here in the Department of Fire Rescue, rather it's a local event or a regional or a federal event, and then funneled up. Assignments that are activated from us will allow us to provide liability, indemnification, and workman's compensation. We'll talk about some of those local laws that have been put on the books over the last decade that provides for you that is unique to our specific Medical Reserve Corps in comparison to other regions. Ultimately, the decision All right, the decision to accept or decline any assignment is always at your discretion. And we will talk about your general preparedness aspects and understanding your limitations and your capabilities that we understand as busy professionals and Suffolk residents with families and other commitments and responsibilities, especially for a handful of years that have multiple volunteer associations. That it's really going to be based on what information and what task is being provided at that point. So that discretion and involvement is truly what I describe as a challenge by choice that will allow you to make those choices. All right. What we'll be asking of you, right, mainly augmentation of a medical or support staff, rather in a surge medical facility or in our shelter locations. We saw that in 2011 with Irene, where we supported co-location shelters that took in medical needs that traditionally in the past would have been sent to special needs shelters. General components of that way. Distribution and dispensing of equipment and medications when we talk about the Strategic National Stockpile, the SNS, and push components of federal resources. Suffolk County is the downstate regional receiving point for a lot of this stuff for us, and Nassau and Westchester. So that components really exist there. And ultimately providing some administrative support, especially during the emergency aspects. Some technical support from the medical field is key in what's called the ESF-8. That's the structural position of the EOC when it comes to health and health services. Having those kind of components here allows better information and decision making for the decision makers of the system. But important, again, stressing from the last slide, you'll see some of this redundancy aspect. Important to identify the limits of your own skills, never working above your physical as well as mental abilities. Some of these conditions that we might be working in will be, rough, a degree of being able to, survive on your own and have maybe some of the finer things in life not available in a shelter. It's going to be key to understanding what those limitations are and that barrier. And then ultimately staying within our scope, working within that scope of your professional license in that way. During times of non-emergencies, staffing, we've seen in the last year some of our involvement getting involved with, medical screening for, the homeless, providing prevention and education material to at-risk youth, supporting our special needs registry program with assistance with registration as well as information about the program, calling out of that client registration list, assisting with volunteer recruitment. I can't stress enough, each week we're gaining 2, 3, 4, 5 healthcare professionals, and it's our best recruiting method is you, the member, your professional associations between the ENA Association, Nursing Association, the Suffolk County Medical Society chapters, all those types of connections are a big help. So if you have that ability, you're in that kind of position, school and nursing programs, you're teaching as adjuncts, and you're looking for us to make a presentation, maybe work out something, I really welcome that opportunity, and would really love to grow as far as our MLC. We're one of the larger MLCs in the state, and for us to really be able to provide some of the assistance and the commitments, we really need to grow more. And then participation ultimately in disaster drills and exercises, rather as flow controllers, event evaluators, mock patients, or even in the long-term, drills and mock-up exercises, participation in surge capacity. We will see that. Okay. The other thing that I will stress is volunteer training for those, especially in the mental health profession, or you have a unique topic that you like to speak about. Please just, you'll get my email later. Let me know. We'd love to plan you into that opportunity to provide not only for the MLCs, but supporting of the regional EMS system with specific topics and instructions. A great way for us to network, get to know our fellow partners in preparedness, and following through on that stuff. All right, how will we contact you? So during emergencies, in emergency management, we're really stressed for preparing and having a degree of redundancy. We had this prior to Irene, and when we activated as an MRC and as a region, the first time we actually evacuate and open large multiple shelters, we need to really use this. So these systems are used usually in everyday business, so we become really proficient with it, and you guys kind of understand what it is. When I first started running the Suffolk MRC in late 10, early 11, there was a lot of this stuff people didn't know who was contacting and what was happening, so it's important that way. We primarily will use the state serve system. That's what you've enrolled in. There was pluses and minuses with it in my personal description, but we primarily use that. The pluses are that it gives us validation to your credentials and does background information on it. The negative side of it is that the website is not email driven. What I mean by that is if you lose your password, you have to call up the state help desk to get a new password issued and reset. It's not something you can just put in your email address and it resets your password and sends it to you. The other downfall with the serve system is that all the regions are using it. All these regional teams utilize it, and it's kind of no prioritization, first come, first serve. So, imagine a much larger MRC having to do, 1,000 or 1,500 phone calls prior to us getting our message out. So, in doing so, what we've done is we've layered it. The county does have its own mass email distribution side of the system, which we take all your information from the serve system and we export it and put it into that program, as well as our Code Red, which is a mass phone call notification, and it gives us the ability to utilize both sides of it. The other nice feature with the redundancy is, if we lose one side of the chain of survival, we'll say, we have the other one still holding us up. The county forward system is an actual voice recording from us. It's that gets played back with the instructions. It acknowledges your acceptance of the phone call just by you picking it up. Where the serve system, it's imperative that you listen to the entire message and follow the instructions at the end. Rather, it's a #9 option to acknowledge the message. If you fail to do that, it will go through a recall process to keep trying to reach you. All right, so ultimately, you get a phone message from us, listen to the whole thing, follow through, and see what the instructions are. Again, your choice of involvement in an emergency event or even a non-emergency event is strictly up to you, and we'll talk about that. We are starting to use more and more social media. We saw in Irene some of the information we put out through our social media. The local news venues will follow us and like us, see a lot of that information. That will also allow us to solicit spontaneous volunteers, based on the needs in that way. Okay, so feel free to follow us on Facebook. Non-emergency, and administrative issues, our main method is going to be emails and the utilization of our website. Now this is the beginning of March. We will be turning that on live, where on our emergency management website at the top of the MRC page we'll have updated newsletters, posts, active links, all those kind of components there. We will utilize the email and the phone call out system periodically for virtual test call outs. We're not just going to randomly make sure the system's is working. We usually have a tendency to make a strong effort to associate it with other pertinent information, not really trying to tie up your time, but email is the main driving one. We do have probably about 20% of our membership that do not utilize email. That makes it much harder for us to kind of spread the word. We're looking for a phone tree call-out type of system where we get volunteer buy-ins from you, the MRC member, to place yourself in that phone system and then know who you're calling next, and kind of have it like a 10 or 12-fold type of tree branch system. So there's not that many. Worst case scenario, we were looking at 10 phone calls in that way to give us another degree of redundancy and reach the other component of our membership. Okay, of the volunteer notifications, I've mentioned some of it already with the serve system. The newer thing that was just been turned on here now in the month of March of 12 is the Incident Response Management, IRM, you'll hear it referred to in the service system. It gives us the ability to electronically schedule you, have you call in, accept shifts and assignments, receive job action sheets and Google instructions and mapping, and it lets us track it, all smartphone type of capable. We in the county, both healthcare-wise, emergency management-wise, and agency-driven, utilize software called eTeam. It's an emergency management type of real-time data sharing between all the two, and we're looking in the next 6 to 8 months to build that bridge between the service system and eTeam. But those that come and do the orientation of the Emergency Operations Center and participate in the EOC will definitely get some training on eTeam. It seems to be a little bit daunting, but it's really easy to use and real user-friendly. Again, nature of the event, what you're being asked to volunteer for, and instructions, we will throttle that information out based on the event or the nature of the event. And it's usually very limited aspects up front: date, time, a general location, and a general description of what we're doing. A lot of reason for that is security aspects, keeping some of the information internally, seeing those that are interested in participating, and then following through with the more details. It's very important, especially in the emergency situations, to limit what information we're putting out past you, the volunteer. So information has to be considered confidential and managed appropriately. No reposting of stuff social media-wise, things along those lines, because it really hampers our capabilities, especially as we're trying to set up or manage pre-event components that way. Okay, accepting of an assignment, right? Like I said, you'll get the basics: when, where, and whom you should report to. We will use the Incident Response Management System through the state for scheduling-wise. So a lot of that might be, if you don't utilize computers and you're not going to do it through that system, through connections and emails, you would call the call center number, which would be published at that time. Speak to a live person, get plotted into a schedule for acceptance, and set off that way. What is key, both emergencies and non-emergencies, we understand things happen, but it's important that you either report for your scheduled assignment or you notify us. We just can't have no-shows. We will have maximum staffing levels and minimum staffing levels, so we have a tendency to try to pad for a little bit of that. I understand the shift life and working that and having the other components that are there, but it's imperative that if you can't make something, simple email or a simple phone call really lets us manage it more. I don't want to overstaff things where people are just standing around. You don't feel useful. And I also don't want to understaff stuff where it becomes either a safety or a health concern in that component. Okay. Most importantly, and this is the next phase of training is really kind of stressing this family communication plan. So IS 22. Are you ready? There are several other tools that will be placed up on our website that will help you facilitate family communication planning and documentation, knowing how you can get in touch with relatives, how they can get in touch with you, managing them more appropriately. An important part of this is managing your emergency contacts within the service system. A lot of you forget who you put down in there. Some of you just bypass it altogether, and we don't have capabilities of sharing your safety and security with that component or managing it appropriately. As far as declining assignments, it goes for both emergencies and non-emergencies. If you can't participate, just if it's through the phone system, listen to the instructions and follow through with it. You don't have to respond to emails with you're away, or I'm sorry you can't do this. It turns into large volumes of emails. I traditionally can end up sending out a non-emergency type of event planning aspect and can get 200-300 emails back from that, and now I have to go looking through those to just find the 12 to 18 to 24 people who can participate. So I appreciate it. I know you're there. I understand the busyness of our lifestyles and our commitments. So if you can't do it, don't worry about it. Just move on and we'll follow through that way. If you see that there is a long period of time that you know you're not going to be available for something, just let me know. We could move you to temporarily unavailable in the system. You won't get some of those redundancies and emails in that way, and we could do that. Okay. Contact-wise, right? It's important for you to maintain that serve system. Here's the help desk number. The help desk number is there if you forget your password. Unfortunately, I don't have the ability to reset your password. I do have the ability, though, to update your account and modify stuff. So if you're not computer savvy, you don't have the patience for it, feel free to contact me. We'll set up a time where we could go through it over the phone or in person, and we will update your system. It is imperative that you do that. The goal starting this year, hopefully, once I clean up the system a little bit more, is we're going to be reaching out to you in the month of your birthday to try to just verify the information's in there. You're still currently interested in participating with us and following through in that way. All right. How do I contact our locals? So here's the main site, my information. I will also give you a generic email address, which is mrc@suffolkcountyn.gov. That goes to a distribution folder that way, but my personal information is all right here, and I'm accessible 24/7 by email, folks. Okay. What's expected of the volunteers? So responding to emergencies, no self-referrals, accepting those assignments and reporting in that fashion, depending on the assignment or the security features. We might have you report to a deployment center, credentials verified or updated or issued, depending on what level of membership you are. Maybe receiving some just-in-time training, and then us, bringing you to the physical site. It's imperative, and we stress importantly is making that commitment and following through. And we have a couple of uniquenesses to training that we will share with you shortly in a couple of slides. But completing that minimum training requirement is key. Safety, liability risks, that key component, minimizing errors, minimizing failures of communications. That's really what we're looking at there. All right, and ultimately, not only working as part of the team, but privacy and confidentiality is really, really important. What should be expected of you, right? So have transportation ideally to the site. Sounds silly, but that's one of those requirements. Work under stressful conditions. So really, if you have a question about what's being asked of you, what will be important there, don't be bashful. Just send us back that email. Yes, you're interested in participating. We'll make that phone call to the deployment center. Ask the conditions that you're going to be working within. If you have health or restricted mobility issues, whether it's temporarily or permanent, those are going to be kind of some key components in some of the assignments that you might be asked to. And really having that preparedness aspect within your family. So the initial stage of training and membership-wise is really driven towards that family communication and family preparedness. We can't ask you to leave your families or loved ones that will need you if they are not prepared for you. Most of us won't be able to do that. And self-sufficiency is key. So in that aspect, self-sufficiency for the first 12 hours, we issue MRC Go bags, and we still have them available. Just email me a date and a time. We'll talk about the ID card shortly and that. But, really that self-sufficiency aspect for the first 12 hours is kind of key. From 12 to 72 hours is where the county is really going to kind of step in and do that. Greater than 72 hours, that's what it would take for us to have, federal assets, state assets kind of dropped into us in that way. So preparedness and planning is key in this aspect. All right. We do offer, all the training is free. We're talking about truncation of the training, and we'll get into that in the next slide or two, the abilities of what's unique about us. But we do have specialized training, especially for our EMS personnel, the ability of, utilizing some of this for CME, both core and non-core. For our nursing population, PALS, ACLS, things along those lines, even the physicians. So we do have specialized stuff If there's something that you think you'd like to do, let me know, and we'll do everything within our power to help you out and provide that for you. Some of the specialized training, especially those big ticket items, PALS, ACLS, the only fee that might be associated with it is books, depending on quantity, needs, and budgets along those lines. But I can tell you right now it would be drastically cheaper than what you'd be paying for on the outside. So we've done some of that in the past, and people, once we tell you what that number works out at that time of what we're getting the book for, and we buy them in bulk, so it's cheaper than an Amazon or a bookstore type of deal. You do have the advantage of prioritization when it comes to not only prophylaxis, but first responder shelters, so it's a little bit better quality life, more of a secured facilities. We utilize the police academy, a couple of the locations throughout Suffolk where you can have your family taken care for in larger events. Or else the other thing we've seen is family involvement. You have older teenagers that are with you that are tagging along, and we get them to volunteer, and they take on other associated tasks. Something as simple as sitting with that more senior friend in the shelter, reading books, participating and pitching out, helping out with food preparation, or general cleanliness within the shelters, things along those lines, safety, security, in that aspect. Okay, our volunteering aspects when it comes to training, as you can see by this, we're going to definitely utilize live webinars as well as archived video stuff for presentations. We will do meetings, larger scale events. We will try to have this multi-pronged approach to it. But what's more importantly is that we will utilize and take into account your life experience, your professional certifications, and your clinical experience, especially when it comes to some of the core competencies and unit trainings. If we could truncate something, one large class, into 5 or 6 blocks and identify that, bloodborne pathogens, respiratory protection, other minor components that you're required in your clinical environment to already have ICS, but instead of 100, 200, you have, hikes for a healthcare setting. It's all relevant. It all could be evaluated. I will show you in a minute, and we'll talk about some of the tracking tools that are there, but we'll be able to truncate that and go through and identify core competencies. On the website there, if you follow down from Suffolk and you go out to the end Medical Reserve Corps page, the training plan for the unit will be posted up there, and it'll show you core competencies and suggested sites for some of the the website-driven stuff that you could do. Okay. The real goal is to try to keep them short and truncated, 30 minutes to an hour, I'd say. Definitely less for the in-class environments, 45-minute presentations, 15-minute questions and answers. We might have days where we truncate and put more of those types of blocks together, so people could dedicate maybe 3-4 hours and get several things done at one time. The other option is MRC Train, federally ran. It's free. You just got to get a separate registration, and you could clip off a lot of classes of the train site if you start to take classes, and there's ones that you like. So people usually in public health are usually in the federal train system already, or a state system. If you have other sites that you feel would be relevant to fellow MRC members, let us know. We'll definitely send that out there, and we'll do that. But the nice feature is they're self-paced courses, throughout the year that really allow you to kind of look at stuff. All right. Membership levels, this is something new. The last month we've been looking to finalize this, this one webinar, as well as the training documents and the other plans. We sat and participated with the advisory group from the State Department of Health regionally. A bunch of regional coordinators got together. We had to come up with post-Irene standard terms and definitions. What's the minimum training? What's the minimum aspect that we look at that? So what I've listed here is the basic level of enrollment. I could tell you by our preferred classes, which are listed there obviously for intermediate, full, and advanced, those meet other core competencies that are the minimum requirements at those levels. These are generically. So you have all enrolled, or hopefully enrolled, unless you've just watched us the first time. Enrollment through the SERV system, and you've gotten completed, and that brings you in at this basic enrollment level. You have the abilities to do a chunk of the minimum core competencies, which are covered here today, and then follow through. Your picture ID, we have the capabilities out in the app bank, so you just email me or call me and we'll set up an appointment at a time. It takes less than 10 minutes to issue your ID card. We validate your SERV system information, and we could issue you your go bag at that point. The Associate Active or At Ready membership is that intermediate level. This is where we'll see about maybe 80% of yes. So the difference between the two is At Ready is you tell me I only want to be called for major disaster, major emergency. Versus the Associate Active, you'll participate or be willing to participate in some non-emergency public health type of initiative stuff. Okay, which could, pods, flu pods, family preparedness initiatives within our library system, some of our other programs, special needs registry, things along those lines. All right, that's about 80%. We'll see about another 15% of yes become this full level green. All right, which allows us to participate a little bit more actively in not only public health preparedness but emergency response aspects, especially as the county grows and gains in capabilities. And that final advanced level blue is that highest level, seeking out additional training, maybe participating in some federal training which is provided for you, working within some of the MRCs or emergency management and preparedness subcommittees, providing a professional opinion on components when it comes to planning, really kind of taking a multi-pronged approach and a look at it. All right, within the SERV system, you have your layers of emergency credentials 1 through 4. That's something that will come out and is tracked that way. So what ends up happening is, a level 1, the lowest number, has hospital credentials and privileges, and it progresses on where level 2 is, a clinical private practice setting, anything outside of a hospital, and it proceeds on. So we take these basic levels and we take those, emergency credential verifications through the state, and what that allows us to do is put a pecking order to how we're calling you out, especially for emergency situations. So I'll give you an example. Now, we might poll the first wave of advanced and full level providers 72 hours before an event, a known weather event's coming up the coast. We're looking at that. Those people might be forward deployed. They have the training, they have the credential verification. We're able to schedule them and move them. Where the at ready, the standby member or the associate member would most likely might be getting second wave notification and then a choice. This is the gray area where some of them might need to come to a deployment center, get some just-in-time training, and then deployment from there. Where the standby member who is just basically in will have to report to an enrollment center, a deployment center, verification of our credentials, IDs issued, and sent from that way. So, you could see that, especially if you're looking to become involved in stuff, as we progress through the training, that would definitely let us help. This is the advisory, committee's little sheet of what they looked at. You could see the connection and similarities between levels and names. These all carry over if you look on our website at the training plan. So it's very structured in that way. This is the customization that I showed you on the last slide. So basic orientation, which you're all taking, some form of psychological first aid. Those are the minimum aspects, and ICS, okay, and the roles. Okay. Importance of training, right? We're really looking to reduce that liability, as most importantly, besides the liability, minimize that safety component. Or I should actually say maximize the safety component and minimize our risk. Right? Lack of training can result in costly mistakes, both patient care errors as well as physical errors. So we really want to kind of reduce that, and that's why we strive for that credentialing process. And you'll see in another slide how we do that, how we maintain that, and how we track that life experience and those other participated activities outside of the MRC, inside the MRC, and so on. Right? Enhance capabilities. So with training, we're decreasing our learning curve. By utilizing the incident response management system more frequently and more often, even for non-emergencies, we become more familiar with it. We know how to do it, and we'll be able to manage it a lot quicker. Give you an example. Just by us utilizing the system, I kind of learned quickly that not everybody has smartphones and emails, so maybe their text character limited on their cell phones, things along those lines. So we have to make short, brief, simple messages in that way. So if you see something that seems a little encrypted or decoded, it's because other people have shorter data plans. So we really have to become a little bit more efficient in that, as well as increasing that learning, decreasing the learning curve and increasing our capabilities. All right. And ultimately, with training, we feel more confident, and we're able to minimize that stress. Cumulative stress, especially in these environments, over a period of time, really takes its toll, and we want to try to minimize that. That health impact side on that way. All right. How we plan on tracking this, right, is through this task book. This is something that we have taken this concept from our urban search and rescue team, done on a federal side where it's task book driven. It's a simple 4-page double-sided little printout PDF file is on the website. We could also assist those without computers in doing this, and it just tracks it. It tracks your life experience, your involvement in exercises. It lets you be evaluated. It's very simple, very straightforward. We encourage you to keep photocopied shrink downs of some of your credentials, so driver's license, MRC ID, nursing certifications, PALS, ACLS, any of that kind of stuff, especially that you're doing, attached with it. So if we're deploying regionally and we're going to go work, let's say, in a Red Cross shelter, and you're meeting, who you're going to be answering to, which would be disaster, mental health, or the medical branch of their nursing program. Here's the credentials of who you are and what you're capable of doing. It really cuts down a lot of that unknown and breaks down the walls. One of the nice things is regionally, we do train frequently with our Red Cross partners, our partners in preparedness there. A good chunky is our share your volunteer responsibilities between groups like the Red Cross or the CERT team, the Community Emergency Response team. So that's, the nooks and the crooks. It'll really allow us to take a lot of that stuff in components. All right, stress before the importance of, managing that service program, right? It allows us to pre-credential you. I mean, old school 2004 when we started, you'd have to go to your local police precinct, get fingerprinted, do all this stuff with the health department to get your credentials, capacities verified. Now we're able to do that. The service system, every time you access it or I access your individual folders, it runs a verification and credential aspect against all your licenses, State Board of Ed, DEA, things along those lines. So periodically stuff gets kicked back. Maybe you forget to renew your license number in the system, but you've done it, so you'll get that little happy email or phone call from me looking to kind of update that. I try to do that at least once a month, but some of the components here become daunting with time-wise. The MRC is only about, as the coordinator of the MRC, is only about maybe 10-15% of my job time. So it's a lot of work as it grows. So I'll definitely be looking for some help along that line. Greatest way you could help me is maintain that printout page of your password when you first sign on, and manage it that way. If you lost it, definitely that 800 number from the state to let you do it. But access across the database is going to be key, and tracking wise. Okay. So some of the administrative issues that we've covered, we'll start here with the ID card, because that's going to be the biggest one. So you're all going to say, how do I do that again? Just email me that ID card and that go bag. Schedule a time when you can come out to Yaphank. I'll send you the directions to Yaphank to where we're able to do that. As we do some of the MRC larger meetings, we tried that last year where we packed up all our ID card equipment and brought it with us. The problem is, there's only so much time pre-event that we could run it for, of how many ID cards that we can do in a period of time. So it becomes a little bit, if you're going to wait for that ID card for that event, we can do it, but it's time consuming in that way, so it might put you under a little bit of an unnecessary stress. Confidentiality agreements, as the events unroll and we roll out, instead of trying to just keep one on file, the confidentiality or the photo permissions, as those events happen, we will have you indicate or sign for that stuff. So if you have reasons why you don't want to be photographed in events or exercises, let us know ahead of time so we could avoid having to delete photos of that way. But photographing and documentation of our events or exercises is key. A lot for deliverables when it comes to grants, aspects along those lines, documentation of what we're doing. More importantly, or in addition to that, I should say, promoting what we do. What the value is of the MRC program and the true cost savings and advantage to the components. There is local laws on the book, Local Law 35, which allows for you as a sanctioned volunteer that's activated in that capacity for the MRC to be covered as an employee. So workman's compensation, legal liability issues are all protected and provided for in that way. I can't stress enough, the only way that happens is if you're a sanctioned responder. You can't self-refer and just show up to something in that way. The two white items here, standing operating guide is what we're working on next. Hoping to have that done by mid of 2012. Operation guidelines, and then from there we will talk about the ability to develop some shelter protocols, things along those lines that could be turned on and off based on the event. Okay, and then train registration. The real thought on a state level is if we're going to go into a federal train program, we'll utilize more of the state healthcare learning platform. I think both of them are great. I really would like to see us utilize both for the simple reason it gives you, the volunteer, the choice of what works best for you. Okay. Let's see. I really appreciate your time. Again, if you have any questions, what we're going to look to do is, have you definitely email me. Email me those questions over. I will show you on the next page, or you could call me with your questions. We'll track them down. The goal will be have an ongoing running frequent asked question and FAQ list up on the website that will be available to you. I got to thank my friend Bruce, my IT guy. He's our big Facebook guy who hacks away. We utilize one Facebook account within Fire Rescue for all the different little aspects instead of trying to maintain 5 or 6 different ones. So if you utilize social media, please feel free to use us. I'm going to leave this last screen up here as we talk in the last couple of minutes just about some of the services. That's another great email address up there, the MRC at SuffolkCountyNY.gov. That will give you the ability to send that out. So especially in events or emergencies, we add people to those accounts so that it's a 24-hour real-time type of approach to it in comparison to you sending it to me. And I'm tied up either operationally or doing something else or tasked with a different task. You could get more of an answer, and then administratively we all just respond to all and CC it in there, and everyone in the list knows that it gets taken care of. So your questions are answered in more of a real-time, quicker turnaround. Okay, the train organization, MRC Train for self-registration. Again, you have to self-register for that and track it. Print out that page, our Facebook account, and then some of the programs. Code Red, that mass notification system, is something that you as an MRC member is categorized and exported and put into there. So you're an MRC member, and then I put in what level of credentials you are and your clinical background. It lets me sort the data and call people out in that important way. That is a great program from our main county website, SuffolkCountyNY.gov, that you should register your entire family, your work location, things along those lines. So when events happen, the police department, the fire rescue maintains that system, but the police department has an active shooter or a specific situation, a lost child, an Amber Alert type of component. We have the capabilities of triggering that system based on geographical, right down to specific houses on streets. Okay, so great program to do. Our other program that I really have a passion for is our Special Needs Registry. Many moons ago, it started as the Joint Emergency Evacuation Program, JEEP. And last year we turned it into a secured portal of information. The nice feature now is it's dynamic in the process. So instead of us looking at 600 pieces of paper and figuring out who we move first based on the event, whether it's a weather event or a local emergency or a regional event, we could prioritize not only the greatest people at danger or in risk, but also those that need the greatest services. We saw this utilized in Irene. It worked out nice, where we were able to move some people that in the past would have had to have gone to hospitals, that we were able to move them into a special needs shelter at the county's John J. Foley Nursing Home, and then others that were moved to more appropriate shelters. So, we bypassed 1 or 2 general population shelters to put them in a co-location shelter, a shelter that had, greater capacities, dedicated lighting, maybe some components of environmental controls, handicap bathrooms, more modern type of schools that we used. So you don't have to have a special needs just to register for it. It will automatically email you back your passwords and codes, and it'll allow for notifications of information. So usually twice a year we will try at a minimum to contact the people to update their registry information, assist them with that, as well as update them either on an incoming weather event, some type of emergency preparedness information. Last year when the FCC did the test of the broadcast system, we did that, where we notified them all. And then the MRC page on the county's website is key. That's where a lot of this is where you've gotten this presentation from, in that way. Okay, so 2 great programs. If you're looking to network maybe your private practice or your clientele into the registry program, we have ways of mass bulking data into it and taking that information. Please give me a holler. We'll try to work that out, and we'll manage it from there. Okay, so that's it for me. If any of you have any questions, I will leave that up there for a minute or 2. It gives you my other personal information. Any of the questions you have, please don't be bashful. Give me a holler, an email, and appreciate your time. Have a great day. Bye-bye.